Hi, my name's Inzi and I'm a primary care nurse working in the community. I'm also a home care nurse. For those of you who don't know what primary care nursing is, it's basically any nurse that works within the community setting. That can be working within a GP surgery or, like me, going to people's homes. I love the job that I do. I feel like more and more nurses should be encouraged to do primary care nursing from early on in their career. So if you're a newly qualified nurse and you're being told that you don't need to work in the community, you need to go in the hospitals and get your skills, don't listen to that. It's definitely a myth. Newly qualified nurses can go into the community straight after qualifying. You don't need to go into the hospitals and get that experience to go. So definitely go for it, gain that confidence within your placements as a student and go straight into the community. So some of the tips that I can give you as a newly qualified nurse would be, don't be afraid to aim higher when you're starting your career. Don't be afraid to go for roles that you feel like you might not be qualified for, because the last thing that can happen is that you'll get a no. So be confident in going after what your goal is. And that comes from understanding your why. Why are you applying for the role that you're applying? Why do you feel the need to be in that sector? Ask yourself, what is your long-term goal? And look at that when you're looking for roles as a newly qualified nurse. The other advice that I would say is take your time with everything. Just take things one step at a time. Being a nurse can be very overwhelming. So taking your time with things will ensure that you don't get burnt out, but also will make sure that if you do need that help, you've got that time to think about what it is you need help with. And lastly, take care of yourself. Take that time to really care about yourself, your mental health, your physical health, and everything that is to do with you. Because it's so important that you're well if you're going to look after other people's well-being. Some of the things that you might need to consider before starting nursing can be, is this the type of career for you? Are you passionate about looking after other people? Even if the hours are very, very long, you need to think about whether this is something that is not just a career, but a passion, because you need to love what you do. It does show sometimes as well when you don't do things because you love it, it shows. So definitely think about whether this is something you see yourself doing in the long run. Also think about the type of nurse that you want to be. Do you want to be a nurse that's working in the community, or do you want to be a nurse that's working in the hospitals? So look at those aspects, and what I would suggest is doing like a placement. Maybe call up some community placements, call up some hospital placements and see if they do like work experience there, just to see what the environment is like. So definitely consider that. And lastly, I'd say think about your career goals. So look at what kind of long-term goals do I have with nursing? Do I want to be a band 5 nurse and just stay and work on the field, be frontline? Or do I want to be more of a trainer type of nurse where I educate people on things? So think about the longer term in terms of promotion. Where do you see yourself in maybe 10 years? If you're a student looking to get into nursing, some of the advice that I would give is definitely prepare beforehand, contact the university lecturers, or actually contact your librarians. They would be the ones to help you in terms of any academic work that you're doing. Once you've done your coursework, you can also contact the librarian so they can check and make sure that you're on the right path. Make sure that you speak to your faculty leaders. Make sure that you are part of a union at your universities so that if you do need that support, you've got people that can definitely support you. Another thing that I would say is never leave anything last minute. Although sometimes it does work, it doesn't work in hindsight. So definitely never leave anything last minute. Always prepare beforehand, and make sure that you've got a plan with preparing. So make sure you've got a structure of how you're going to do things, and then you look at that structure in order to execute what you're doing.